Hello, my name is Ava Wynn and I'm joined with and Miss Angie Wilson. And since February is Heart Disease Awareness Month, we decided to do this podcast episode joined by someone who has recently undergone heart surgery. So, Miss Angie, could you please introduce yourself?
Hi, I'm Miss Angie Wilson. I am the mom to Devin and Avery Wilson, who are in 11th grade at Northview High School. I work for Quality Care for Children as a family well-being and support manager, and I underwent open heart surgery in September, which is what we're going to talk about.
So, seeing as you did go through heart surgery, like how did you feel when you first found out, and like what was it for?
So I knew I was going to eventually have to have heart surgery.
Mm-hmm.
When I was 30 years old, I had met my husband, and I hope I'm not aging myself here, but he told me, before that I had been in college, and you know, I had a job, I had insurance, and I would just go to clinics to get seen.
Mm-hmm.
And he said, you need to go and really see somebody, you know, just to get an overall baseline of your health. And so I went and I saw a doctor, and he said, do you know you have a murmur?
Oh, wow.
Nobody had ever detected a murmur. I mean, I was 30 years old. My parents were very good at taking us to health checks, and from my understanding, you know, all of a sudden it's sometimes, you know, they hear a murmur. So he heard a murmur, and right away he started, he told me that I needed to go see a cardiologist.
Okay.
So I went and I saw a cardiologist, and after that, like every year, they determined that I had a bicuspid valve.
Okay.
I was born with a bicuspid valve, and that eventually someday I would have to have valve replacement.
I see.
Could you explain what that
Yeah, like kind of the
A
anatomy of what that is.
Oh, I'm not an expert, but so I was born. Most people, almost everybody is born with a tricuspid valve, which is the valve that opens the heart chamber and pumps the blood. I was born with bicuspid, two valves.
Okay, two.
So eventually that wears on your heart and your valves and stuff. So so when I was 30, I knew that I would eventually have to have surgery. I kept thinking, you know, this is going to be a long time, right? Like he said, oh, you're in your 60s, you know, 70s. So every year I saw a cardiologist, and I would get a regular echo and a regular, I would get screened every year. And then the valve, it also, like, I have aortic regurgitation. I had aortic regurgitation. And so as I got older and older, everything was mild. My symptoms are mild. And over the next couple of years, I'm not understanding that maybe shortness of breath had something to do with it. I just attributed it to other factors, you know, not exercising, not doing, you know, the things I was supposed to. I had a screening like about a year ago, or you know, my regular thing, and he said, well, it's starting to look like it's more moderate to severe. And I just, you know, I'm like, okay, you know, he says, well, we'll monitor it. And so then 6 months later I went in, and do I continue or not? 6 months later I went in, and he said, well, your aneurysm is at 4.5, which is very big.
Okay.
He said, aren't you having any symptoms? And I said, well, I mean, the normal symptoms I've always had. Shortness of breath, you know, I get dizzy, but I'm like, okay, you know, you keep thinking like, well, I'm dizzy, but it's because maybe I have sinus infection or something, like, you know, it was always something else. And he said, no, he said, you have to see a surgeon and schedule this within a month.
Wow.
Okay,
And I had said, like, oh, let me wait till Christmas, you know, when everybody's on vacation, because, you know, it'll be surgery, I'll be in, out, you know, and people, you know, we're all home. No, it just happened fast. Like, from one appointment to seeing the surgeon, and the surgeon saying, you know, we'll see you in the ER in 3 weeks. And so that was on September 13th that I had my surgery.
All right. So what, like, the surgery itself, like, what was that procedure? Like, what did they do? Did they, like, cause
open heart.
It was open heart.
It's
Yeah.
open heart.
Yeah. So
basically they cut your sternum open, and I tried to YouTube the surgery and procedure, but I think you start going down this rabbit hole of and forgive me, for those who are medical experts, but I was so scared of. I didn't know. I watch a lot of Grey's Anatomy.
Yeah.
Everybody goes on, ECMO, and those are the words that I could hear, and a lot of people don't make it, and so I was like, so I stopped watching Grey's Anatomy. I'm on season 17.
Oh, you got a long way. Oh, 17. It went from 9 to 17. I was like,
I stopped watching that right before my heart surgery because I could not understand what bypass and going on ECMO, like putting people on bypass was.
Yeah.
I literally thought like they stop your heart and they have so long to like do the surgery, and then if it's not done, like you never come out of it, right?
Yeah,
like
scary.
I didn't understand that, so I kept researching it, and then Devin was like, no mom, they put you on machines to, for your oxygen to to pump, and I think he explained it a lot better than what the surgeon did, because I think I was scared of when I asked the surgeon questions. He's just like, you have a large size aneurysm, this needs to get done.
Yeah.
And
scary.
it's it was just, and he's a great surgeon. And not understanding that they're gonna take a blade and a
cut
saw
you open,
and open you up, and even though you YouTube it, you say like, what's the recovery like? Nothing really prepares you for that moment of
like, here I am, it's happening.
This is gonna happen, and what do I do? I draw a will? Do I draw up a will? Do I do this? And you have to do all that, and I really wasn't prepared for that either. Like, what are my what do I want to do if something doesn't happen? What are my directives? Like, I didn't know that. I came up with some pretty harsh directives, probably, that my family didn't think I wanted. Like, don't keep me on a breathing machine if it's not gonna if it's not gonna go through. Those are the things that you have to consider. What happens to our stuff? Where where do the kids go? Or does does my husband know everything, that we have, those are just things that you don't really, you just talk about life and you do life, but you don't really prepare yourself for life and the life afterwards. So
that way of thinking, is that like what you were thinking like right before you were put under as well? Or like what were you thinking?
No, when I was put under, I was just like, bring me back alive, like wake me up, Prior to the surgery, they also they do and I can't remember what it's called, but they do a heart catheterization. I can't remember what it's called, and I should have written that down. But where they go in to make sure that I don't have any blockages. Like,
do they like put a little camera through or something?
It's like yeah. I did that, I think, a week before my surgery, or a week and a half before my surgery. And they gave me, I think a little bit of like fentanyl or something like that. And I was just like, don't do that again. like I was like, what kind of drugs are you going to give me? And don't do it again. I mean, I had heard all the worst things about, like, you hear all the things about like people when they get, a heavy drug and then like they become dependent on it, and being that this was going to be a big surgery, like that was my like, absolutely, please don't do that. And they're like, it's not enough to get you addicted, but I still was just like, do not do that. And they have to. I mean, they have to, and then, it was things. So I did that a week before and everything was perfect. So then they cleared me for surgery.
Okay. Yeah.
And considering like how fast it was moving, you said like in like a month you were like already getting the surgery. How did you mentally prepare?
Yeah.
I don't even know if I really mentally prepared, because I tried not to look at YouTubes anymore. Like I stopped looking at surgeries. I stopped questioning why, because I knew why it had to be done. I think I more physically prepared than mentally, because I had the carpet shampooed, I had the house cleaned, I had things that I thought, oh, if when I come back from the hospital and my family needs to help take care of me, I want to already have this done. I ordered food. I had, things stocked.
The life of a mom. There we go.
But mentally, I think I just said, this needs to be done, and I hope that it's that I have to trust that it's for the best. And I did a lot of research on my surgeon too. So, I mean, he was a great surgeon. So.
Okay, that's good. What advice would you give to like other people that are going through this, like maybe a similar surgery or similar process?
I would say that to come to peace with what needs to be done. I mean, when I think back of saying like, oh, I can wait, this is August, of last year, or June, July, and saying, oh, I'll wait till December because, I still have these things to do, and it'll be easier for everybody else. But you need to learn to take care of yourself first. And I think that comes a lot with having like inner peace as well, and being able to say like things will get done.
Is that how you were like going like after the whole surgery and stuff? Is that kind of what you were doing? Like, how was it like after the whole surgery and the procedure?
Recovery.
Yeah, like how was it?
The recovery was terrible.
I went through surgery for my tonsils as well. They were just shoving down popsicles down my throat. Worst feeling ever. To this day, I can't eat like a popsicle
because
it's terrible.
You can't walk. I mean,
they
get you up to walk like that same day.
Like
you've just been opened up. You have. You have all these needles, you have all this, stuff, you have stuff coming out of your stomach, not bandages, but like, bandages, and you've been cut open, you can't move a certain way, you can't cough, you can't, if you cough, you have to you have to just be very careful, and just coming out of that surgery, and just also feeling helpless because you rely on everybody, everybody to help you to go, to go to the bathroom, to do everything, and they get you up to walk right away, and you're just like, I don't want to walk, I just want to sleep, and they don't let you sleep, because they're like, you have to get up, and you have to exercise, you have to eat, you have to do this. I was in ICU, I think 3 or 4 days, and only because I think they take you out of ICU like the second or third day, and then they move you up, they step you up, but there wasn't enough room at the hospital, so they kept me in ICU, which was fine. And then I think the fifth or sixth day, they moved me up, and I stayed there, I think 2 days, and then I came home to recover.
Yeah. Probably felt amazing coming out of that hospital back to your house.
Yeah.
But like, cause like my family, we've been in and out the hospital a lot, especially with my brother, and like I remember days where we would have to stay at the hospital because I was really small at that time too. I was like 11 or 12, not even. I was like 9, 8, and like, how like how your house has like a smell to it, and like as soon as you walk in, you get hit with that again.
Yeah.
But like, I don't know. Like for me, like whenever we would come back home from the hospitals after like a week at like staying there, like I almost like first I would want to cry, but then I would hate it.
Yeah.
You know what I mean? Like so like I'm sure you guys also have like that smell, that housey smell.
Yeah.
But, like, I don't know.
Yeah, and I think just being in your own space and being grateful that you're alive.
Yeah.
I wasn't able to sleep in my bed, for I think like a month and a half.
Wow.
I slept on a recliner just to stay upright, and then watch how I, went to the restroom, and how I, everybody helped me bathe. I would have to climb up the stairs to take showers and clean my, and everybody helped clean up. But it got better and better. I mean, the second week that I was home, I got really sick. Like really, really sick. Like I was retaining a lot of water. and I was still trying to walk outside, and I couldn't walk. I couldn't breathe. We finally went to see the cardiologist, and they gave me Lasix, to get rid of the water, and still a week later it was still the same. And then finally they increased the dosage, and once the water weight came off, or all the water, it was from like 1 week to another that I just felt better, and I was able to walk, and I was starting to do things a little bit more and more, climbing the stairs on my own, starting to, the one thing that when you're able to like reach up and take, even you don't understand how, if you've never been through a heart surgery, you don't understand how like the importance of even like being able to wash your own hair, or clean yourself, or go to the bathroom, or or how that feels. I mean, it's like, you're like, oh wow, like, I'm a big girl now, like I can wash my own hair. You feel that way, like, you've made these accomplishments, and just being able to, put on your own clothes, your own socks, I'm still afraid of a lot of things. I'm afraid of falling, because I will be on a blood thinner, which is Coumadin or warfarin, for the rest of my life.
Okay.
Learning to navigate that is hard, because I can't eat green leafy vegetables. Wow. And then you have to make sure that you're in range. So I get checked every month to make sure I'm in range, and if not, then they increase it, decrease it, or tell me, right now they're like, eat a salad every other day, even though I'm not supposed to eat green leafy things, but just to keep, I wasn't in range. I was almost not in range. Yeah. So I'm working on that.
Okay. Yeah. That's a lot to take in, actually. Yeah. No, like imagining like just like going up the stairs, right? Because like you've lived all your life, and like stairs you don't ever really think about being a problem, right? Yeah. So like must have hit like a truck.
And I think the other thing too is just seeing my scar, and
oh yeah,
I don't know what it is about, like when I tell people, I had open heart surgery, and I show my scar, and I'm like, why am I doing that? Like, and I almost think like it's like it's hard to show, to show somebody. Well, it's not hard to show somebody, but it's almost like I'm like, look at what I've been through, look at what I've been through, and I'm still here. Like, take care of yourself, take care of yourself, because the scar, will go away. Well, some, a little bit, but I'm just grateful that everything went well.
Yeah. This actually reminds me, so I have an uncle, he lives down in Suwannee, and he has gone through 3 open heart surgeries now, because he had like 6 heart attacks. They had to put a little like metal, it's like a mesh, it like expanded out his like vein, like what arteries, so blood could flow through them.
Yes.
Yeah, and so I remember one time it was Eid, and we were celebrating, and he was changing into his clothes, and I remember seeing that like line right down the middle, and this was like recently after his surgery. He had little metal braces kind of keeping him closed, and like it was just like so surreal seeing that. I'm like, I've never seen this on a human, right? Like just like metal sticking out, and I'm like, it was intriguing, like how, like, because he's gonna have to wear this for like at least like another 2 or so months before we can remove him. And I just think to myself, like how does it feel to just have, this scar, and like how does it hurt to move, and like
it hurts at the beginning, and occasionally I still get, because they said it takes about 12 months to be fully recovered, because I guess your sternum has to I mean, I guess they bond it with he told me titanium.
Yeah, titanium. Yeah, because it doesn't rust.
Yeah, and I still have like I try to like touch it and see. I do have some sort of spots. I did have, my neck was about this big right here. They call it a turkey neck. and I every time I go into my appointment with him, I'd be like, "Is this gonna come down?" And he's like, "That's what you're worried about?" I'm like, "Yeah." Yeah. This is he goes, "It'll come down. You'll heal. You'll heal well." it hurt. You know, you get pain, like sometimes I get pain under my underarm, and I think it's they pulled, you know, your chest cavity apart, and I can't even fathom that. Yeah. Like, occasionally I'll still look at like pictures of, like, I'll go on, like now on Pinterest, like I try to read women's stories that have gone through it, and you know, and then they show like how it's, you know, what they're going through, and I didn't get depressed. Oh, maybe I did. Probably I did. I did get depressed. But I think it was normal because you have all these emotions going through, you know, and hormonally, like it was a big surgery. I don't wish it upon anybody, you know. But if you have to have it, and you know, if you have to have the surgery, or you have to have some, you know, surgery with your heart, I mean, really do your research on who's doing it too.
Yeah. That's definitely something with my parents, especially like after like my surgery. So they actually got really lucky with our surgeon because during mine, back when I was really young, like when I was like 4 or 5, I had a mild case of hemophilia, and at that time, like, so they actually caught it while they were like cutting open, you know, my tonsils. But the thing is like when they were doing the surgery itself, like it was so mild, like you almost wouldn't even notice it, like the fact that I was like actually losing blood. But like kind of like with your condition, like over time it got worse. And so like I was like bleeding profusely, but we got really lucky that like during the surgery they were able to see just that slight discrepancy and seeing like, you know, this kid's actually kind of like bleeding a lot more than he should, right? Like, so honestly that saved me. And like the thing was, like, I remember my mom telling me that like we've been to like 2 or 3 hospitals, right? Because that was back when it was just with my mom, and like we were living in like Buckhead, Lawrenceville, that area. And so like she literally didn't know where to go, because like this is like when she was also coming to like Georgia for like the first time as well. So like I'm actually so glad that like I think it was Children's Healthcare of Atlanta. So I think they're the ones who did the surgery, and like I'm just I'm grateful they found that, because like it would have been bad otherwise. Like they wouldn't have been able to like supply me with the blood that I needed like within like literally hours. So like, yeah, no, you're right. You do need to find the right people to take care of you.
Yeah, and a good cardiologist. I mean, I know there's great cardiologists. The way I found mine was we moved back, and I just reached out to friends and said, you know, if anybody knew a good cardiologist, and they recommended. He is in Lawrenceville, and his office, I think, was in Lilburn when I went to go see him. So, I mean, I don't mind the 45-minute drive or 30-minute drive that, you know, to go see somebody that's good. And then I did have my surgery in Lawrenceville, at Northside at Lawrenceville, and they have a new cardiac group and center and you know, wing. And so the doctor that I got the surgeon was like absolutely like top notch.
Nice. Yeah, that's great. Yeah. God, this is bringing me back to my old surgery days. Yeah, I hated those times. I was so sick all the time. I missed a lot of like early school, but you know, over time it definitely gets a lot better. Yeah. You know, like it's just like it's endurance, and you have to have really like, I think the biggest thing was like you really just have to trust like the people around you, because like at the time it was just me and my mom, and we were like living in like just like a place like literally in somebody's basement. We were just renting that place out, and it was just me with these random homeowners that I didn't even know. They were Bengali like me, right? So like we shared the language. My mom was out working the entire day, so you know, the 6-year-old me like sick as like a rat basically. You know, like, who are these people? But like once you realize that like, you know, that they're here to take care of you, and like, you know, everyone around you like, you know, is there for you, like it helps. And I think it helps with the healing process as well. Maybe I don't know, maybe I was a kid and, you know, I just healed faster, but like I feel like having that mindset really did help. So,
and I think being, you know, after you realize that, okay, I am sick, you know, and I can't do everything, it's out of my control. I can't, do this. I can't do that. I can't make dinner. I can't do this. I can't do that. Giving that up and saying, okay, take care of me, and then I'll be okay, and then I can take care of you again. And that's really what I've done. I'm, like I say, the only thing that scares me is falling. So I don't want to have falling or I don't know. I think that's having to go through this again, but I mean, the valve is going to be good for, a long, long time. Yeah, the only thing is just taking care of me now.
Yeah. That has to come first.
Yes. Yeah. Yeah, it's a scary thing. It's knowing, I don't know if my kids were born with a bicuspid valve. I could go get them checked, but so far nobody has the murmur, it might be when they're 30, that they find out, making sure that they do, go to the doctor, and they do get seen, and they get, we've mentioned it to the pediatrician, or, to their doctors, like, can you check, and so far, so far nothing.
So our last question, since it is Heart Disease Awareness Month in February, what do you think the importance is of this whole heart disease awareness?
I think it's making sure that you get second and third opinions, especially if somebody tells you, you have this, well, get an opinion from somebody else. I've had a lot of different cardiologists over the last, 20 some years. All of them have said, different timelines of like when I'm going to get, was going to get heart surgery, but no one can be sure, for sure, right? I thought it was going to be like 70, by the time I got it. I think the most important is making sure that you do yearly follow-ups and take care of, for whatever. If it's not your heart, it's, something else, just making sure that if you don't feel well, like, just don't play it off, because it's, it could be something else. Yeah.
All right.
This was our, hopefully our first episode for this entire thing. We got more to come. Thank you.
Thank you so much for joining us.
Yeah, we are Northview's MRC HOSA partnership, and thank you, Miss Angie.
Oh, thank you to both of you.
Of course.